Antimicrobial resistance is acknowledged as one of the major threats to global health. If we're going to solve that problem, I believe that pharmacists are going to have a really important role to play. Now, I'm at the FIP Congress in Abu Dhabi, and with me is Professor Philip Howard and Dr. Debbie Gough. And they're experts in the field of antimicrobial research and stewardship. And we've been talking antibiotic stewardship. Well, they have, Debbie and Philip have, and they're going to tell us a little bit about their insights now. Now, first of all, Debbie, if I can ask you, sure. Particularly you've been focused on antibiotic stewardship in hospital, and more particularly, I think, in the resource-constrained situations. Can you tell me what the challenges are there?
Sure. In low middle income countries, most of my focus has been in South Africa, but I've been around the world. And you see a lot of challenges. The pharmacists are not infectious disease trained. They are in very traditional pharmacy roles of dispensing and replacing ward stock, but that does not mean you can't do stewardship. So we've successfully implemented antibiotic stewardship in South Africa, spread it across 47 hospitals by implementing within their skill set and within their current jobs. So even if you're dispensing medicine and replacing ward stock, you can still do antimicrobial stewardship, because we see many things that take place in the hospital setting, such as antibiotics left over from the day before. The physicians believe those antibiotics are given if they write an order, and the reality is we know there are a few nurses, sometimes the nurse to patient ratio is not optimal, and the poor nurses literally run out of time, or the IV clots. There's multiple reasons why the antibiotic might not be given, but if the physician is not told that, they think the patient might be failing therapy and change antibiotics, when in reality, they've never received the antibiotic.
So it's a communication issue, do you think, between pharmacists and doctors and nurses?
Absolutely. So that pharmacist that is replacing ward stock and feels they can't become involved in antibiotic stewardship because they need a dedicated job, that's not true. In a low middle income, resource constrained hospital, you can do stewardship even with that type of job description. So if you inform the physician, the antibiotic was actually not given yesterday for whatever reason,
sure.
That is a stewardship intervention, and every pharmacist can do that.
And do you think, I'm sorry to interrupt, but do you think all pharmacists can be involved in the selection of antibiotics? Because we recognise that not all antibiotics are chosen appropriately.
So, right, that's what I call higher hanging fruit. So
yes.
When you're in resource constrained hospitals and they don't have dedicated time to do stewardship or a lot of infectious disease knowledge, giving guidance on the appropriate antibiotic is a higher level of skill.
Okay.
So it depends on what the resources are, what the education level, the willingness to learn.
Sure.
And yes, there is a role for every pharmacist in stewardship, and we cannot afford to sit back. This is our moment now. We need to mobilize pharmacists around the world to do stewardship.
So start low, but not necessarily go slow. We need
That's
to
right.
act
We
now.
need to go fast, but you
yeah.
can start at multiple different levels, and it works.
Okay. Now Philip, there is at least a framework in hospitals, but we don't see that framework so much in community. What are the challenges here?
Do you know, I think antimicrobial stewardship has actually been done in community pharmacies for many, many years. We just call it self-care.
Yes.
And it's just the term antimicrobial stewardship, which I think pharmacists haven't recognised. So often when patients are ill with infections, they'll come to the pharmacist first. The pharmacist will assess them, their infection, to see whether self-care is appropriate. And if it's not, they will refer them on to a prescriber. So I think there's real opportunities during that assessment, really to almost to expand it, to give a bit more education to the patient and their family, all around the dangers of antimicrobial resistance, avoiding using leftover antibiotics, making sure they've got good hand hygiene, all their vaccinations up to date and things like that.
Sure.
Lots to do, but I think we're already on a journey.
Okay, so more training for pharmacists, more education for the patients?
Yeah, very much so. I think one of the things we probably need to do, we need to probably get the pharmacists to start using the same assessment tools as the doctors do, and speaking the same language. And so I think there is a much greater need for clinical assessment tools, that using scoring systems to know when antibiotics are appropriate and refer them to a doctor, or when self-care is more appropriate. There's lots of good evidence out there that you can break the cycle of antibiotic usage by actually showing patients they can get better without antibiotics. They don't have to see the doctor. And once they've learnt it once, they don't have to do it again.
Okay. Now, in the countries we come from, there is a good regulatory system. It doesn't apply in all countries, unfortunately. And we know in many countries antibiotics are available without prescription. So how can we address that? I'll put that question to both of you.
Sure. So, in many countries like India and parts of Africa, it's lack of access to antibiotics that results in the death of patients. So it's hard to restrict antibiotics and require prescriptions for all of them. So that's not reality. We need to make them available in many countries without a prescription. But there's got to be some type of guidance. And you can't have every antibiotic available without a prescription.
Okay.
So, India has really stepped up because they have run out of antibiotics that work in most common infections. And putting some guidelines around the availability of antibiotics without prescriptions is a good thing, and that's what's happening.
Okay.
And it's working.
So in other countries too, you reckon they need to step up like India has?
Yeah, I think so. I think sometimes it's really difficult. The pharmacists are often pressured by patients thinking they need antibiotics. And I think we have a really important role of educating the patients when they're appropriate, and making sure they get the right dose, the right duration, and when they don't need antibiotics. And sometimes it's really difficult to say no, because you think if you're a community pharmacist, you might lose business. But actually, some stories from places like Ghana is actually, business has actually increased because they're giving better quality advice.
I think that's a great point to finish on. Debbie Gough, Philip Howard, thank you very much. This is John Bell reporting from Abu Dhabi, FIP Congress 2019.